Hey ho, it's Paul Liano here from Tangmere Dental Care near Chichester. I'm carrying on doing tests in relation to dental aerosol and how long that takes to settle, and then how effective mitigating factors are in terms of controlling that aerosol, with the hope of being able to prove that we can reduce fallow time between patients. Obviously, if we can do that, then things are going to be a lot more streamlined, smooth running, and hopefully cheaper, so that things can be affordable for dentist and patient to actually have. One of the mitigating features that I've got is the VacStation here, which is basically an LEV, a local exhaust ventilation system, that draws away the air by suction sort of outside the mouth through a series of filters, and then the air is actually exhausted back into the surgery. So you know, there are other things to consider. I've already done an unboxing talking about the filters themselves. I will be doing a future video in relation to the practicalities and logistics of actually placing these units within a dental surgery and them not being in the way. So usual YouTube fashion, if you want to see those videos, then firstly, if you like this video, click the like button, subscribe and the notification bell, and you'll actually be notified of the videos as I actually release them. Okay, so I've got my particulate meter set up over here, a timer on that, so that we can sort of time how long after we've stopped producing the aerosol it takes for these to go down. If you look at a previous video, I have done one where we didn't have any mitigation in place at all, just to measure how long it took for the VapeSmoke to settle. One thing I would say is the VapeSmoke does max out the meter with no mitigation at all, so we can sort of see if that actually, whether the LEV has any effect on doing that, and then how quickly it actually makes those levels drop back down to normal values. So I'm going to be getting Susie, my wife, through in a moment to blow some smoke with this in place. I will point out that Susie is obviously in my social circle. She is an ex-smoker, and the vape she's going to be using to generate that visible aerosol is actually a nicotine-free vape. Right, okay, so ready to go, guys. Just the particulate meter timing out there. Okay, so Susie, come on in and let's blow some smoke. Okay, so I'll just make sure that all's ready to go. The meter's okay there. Let's just move that forward so we don't get a reflection. Okay, so the VacStation is in place. Now I am going to be doing a future video in relation to the logistics and the practicalities of placement of the unit, as I've said before, but I'll just show you that very quickly, because we have to sort of bring this arm into position. So I have actually got the VacStation as close as possible to this spittoon arm here, and of course this sort of flexible joint thing is called a bamboo arm, and I'm finding that that is the biggest challenge. But as I said, I'll do the full logistics video fairly soon. So I need to fire up the VacStation now, and we'll get that in position, and you might see one of the issues here. Obviously, if the patient wants to get up and down, then the arm has to be moved each time. And yeah, let's fire up the remote control. Remember the old wired ones, but there we go. We'll make sure that's on 100%. It's only stable up to a certain distance, so it's one of the limitations in terms of placement. I think I've got that as close as I can. Right, okay, so we're trying for failure. Particulate readings are good. Susie just blowing smoke straight up, and actually let's see if we can work here. So Obviously I've got the particulate meter at my working height, so this simulates where I'll be breathing, and I think this is about right. I'll be able to bring in some instruments from the side. So Susie, off you go. And blowing smoke straight up. And as before, I'll just do a little bit of wafting around to see to simulate a little bit of movement. Oh wow! Okay, so it's quite a bit of escape there. Yeah, we're getting a spike in readings here. How many is that, Susie?
5.
That's 5. Okay, right, we're pretty maxed. Right, we're pretty much maxed out on a number of the readings. That's gone up on the PM 2.5 and it was maxed out on the PM 10. Simulate a bit of movement again. I did see that. It was being caught by the edge, but then spilling out the sides as well. One really encouraging thing here, guys, is even though we had leakage around the bowl, is that values are dropping pretty quickly, which is good to know. Simulate a bit more movement. Right, there we go. We were taking PM10 going to 10 or below, and that's actually achieved that despite huge readings to start off with. 1 minute 18.8 seconds. That's really very good. So this is actually quite encouraging. Even if we're getting aerosol escape, this is actually drawing the aerosol away pretty quickly. The levels are back down to normal. So we're going to be doing the normal breaths now. I'm expecting good things with this unit as well. Okay, so everything's good to go. Susie, off you go. Normal breaths now. Let's see how this smoke goes. So that is actually being drawn in. So normal breathing, we're going to probably be okay with this unit here. Phone is on low power mode. So click it on when we want the timer. Tell me when you get full breaths on. Just waft around a little bit here. A little bit of spillage coming in there. 5. We'll start that up and I'll do a little bit of wafting. Yeah, readings have gone up a wee bit, so we did get a little bit of spillage here. So that has gone up. With the dental air we didn't get anything on normal breathing, but because of that aero shield, which obviously stops that going upwards, I think that just catches a little bit better. Be interesting to see how quickly readings come down. There we go. Okay, just a little bit of spillage. Normal readings have actually been achieved in just over 48 seconds, so that's a significant improvement on the something like, I can't remember exactly what it was, but around about 15 minutes I think it was, without any mitigating features. So that's really encouraging. 48 seconds, that's absolutely brilliant, and levels are coming down even lower now. So we'll be looking at the logistics in a video very shortly in terms of placement. So as you can see, both of these units actually are quite effective at actually speeding up the reduction of aerosol within the surgery. And I think these units are going to be the real game changers. It's just a case of which one do you buy, which one's going to be the most practical. So if you want to actually see that video, then yes, hit that subscribe button, the notification bell, and you will see that one as soon as possible. So thank you very much for watching, guys.